Everybody, and welcome. We're so happy to have such a great crowd today for our webinar. I am not Liz Bencivengo, who is normally our hostess for these webinars. I'm Janet Sturtz, one of the participants today, and I will be introducing the other two and myself. And we're just very glad you've joined us to hear more about EMDR. I'm a licensed clinical social worker and supervisor in Texas and in Florida. And I'm also certified in EMDR therapy. One of my backgrounds in trauma was with the University of South Florida in Tampa, the Center for Traumatology. Also, working with them was the U.S. Southern Command. And I was one of 3 therapists who went to El Salvador to help train 60 mental health workers because they had suffered 2 extensive earthquakes within the span of a year. And so we were there as a form of aid to help train the workers on how to help their people. I also help design research interventions for Central America for many different disasters. For example, a lot of the people couldn't read, and so we designed research interventions where they would do group therapy based on the legends of their area. It was very, very interesting because they had suffered a lot of losses. Okay, so I work with Rejoice and Laetare, and I currently see many different types of clients. And also with us today is Dr. Jessica Barboza and Cynthia Barboza, coincidentally, same last name but not related. So Dr. Jessica is a licensed marriage and family therapist and supervisor. She earned her PhD in human development and family studies from Utah State University. As a clinician with Laetare Group, she helps individuals, couples, and families journey towards peace and healing. She's also a published author and an accomplished speaker, respected researcher in the field of family bereavement. Welcome, Dr. Jessica. And Cynthia Barboza, who is a licensed master's social worker with a specialty in direct practice with children and families. She obtained that degree at the University of Texas at Arlington and primarily focuses her practice on EMDR and cognitive behavioral therapy for adults suffering from anxiety, depression, PTSD, and abuse. She counsels people virtually also with the Laetare Group, and she's been providing EMDR since 2021 with individuals who've had one major traumatic event or many with a complex history of trauma. So I'd like to ask Dr. Jessica first to define trauma for us, if you would. Some of the symptoms of trauma, what it looks like in daily life, and define trauma versus crisis, if you would.
Of course, Janet, thank you. And like Cynthia, I've also done a lot of trauma work and I work with EMDR as well. So just wanted to name that as well as we get started today. So yeah, let's define trauma. So people often think of trauma as these big life-altering events, but trauma can also be, it is that, but it is also can be these seemingly small but repeated encounters over time. And trauma is really any experience in which we are unsafe, either physically or emotionally, and we feel powerless to do anything about it. So our brain processes physical and emotional safety the same. So rejection, abandonment, betrayal, or embarrassment can be just as traumatizing as, say, a car crash. And traumas can really shatter our belief in the safety of our relationships and the safety of our environment. There are several types of trauma that we've kind of alluded to. One is acute trauma. So acute trauma is really an isolated event, similar to someone losing their home in the recent devastating wildfires in California. That's an isolated event. It happened one time. It's an acute trauma. Then we also have chronic trauma, and this occurs over the course of several years, and it involves repeated experiences of being unsafe. This can lead to negative beliefs about self or the world in general, and can have really long-lasting impacts on someone's development, their ability to engage in relationships or socially with other people, all of those things. So it can have really devastating impacts. Both acute and chronic traumas can have devastating impacts.
Thank you.
Yeah.
And Cynthia, what does healing from a traumatic experience look like?
Yeah, thank you, Janet. I would say that depending on the process that they use for overcoming their trauma and releasing their emotional turmoil, usually you experience maybe less fear and anxiety. They might feel that they're no longer stuck in that fight or flight response, no longer constantly recalling traumatic memories, flashbacks, seeing those images that they might feel kind of they might feel like a physical sensation all over their body that just kind of really disturbs them, bothers them throughout the day. So less of that, and more of like that memory doesn't feel live anymore. It's more like they've been able to archive it in the past. They're no longer on edge, not irritable all the time. Maybe they don't have any more issues with sleeping and eating. They're more clear-headed, calmness. They kind of feel that weight off their chest, probably more present with family, friends, and just able to connect with others more easily. I would say that's kind of what we're looking for when we're thinking of healing from a traumatic experience.
Thank you, Cynthia.
Mhm.
And Jessica, what practical advice might you offer to somebody who's dealing with a trauma?
Yeah, maybe I want to come back to a question you asked me earlier, which is the difference between a trauma and a crisis, because I think that's important maybe for us to identify. And when we experience a trauma, we can have the stress of the situation. Well, maybe I'll define that. A crisis is an experience where the stress of the situation outweighs my ability to cope. So someone can experience a crisis and still be physically and emotionally safe. So that could be, for example, like failing an important test. I'm physically and emotionally safe. No one's harming me or I'm being hurt by anything, but I can experience a crisis, meaning that I am not able to cope with that. The current way that I cope with it is I can't, right? And it's too much, it's too overwhelming for me. That's a crisis. So people can experience trauma and not immediately go into a crisis state, which might be, for example, that often happens with loss, which is what I deal with a lot. So people experience the trauma of a loss and may not automatically go into an inability to cope, right? They can cope with it for a while and then experience, and then maybe later will experience crisis when other stressors or other things kind of go on top of their ability to cope or decrease their ability to cope. So I guess that goes into a part of my advice to people is that trauma survivors really should know that they're not alone. Many people have overcome difficult traumas that they've suffered, and a good therapist will not really encourage you to relive your trauma. I think that's what people fear, is that that a therapist is going to ask me to revisit it and confront it and just really talk about it nonstop. And that's not what we want to do or should do. So we really want to help you restore your trauma. And so we're going to be really paying attention to key moments and beliefs and things that you have about your trauma, and really try to pull those parts out and try to really look at that and see how we can create more safety in your story. And current safety in your experience now. So I also want to give the advice that trauma is not your fault, and it's not your fault that you cannot put it behind you. Your brain is ultimately just trying to keep you safe. So anything that you have triggers, you have nightmares, any symptoms that you have is your body and your brain's response to try to keep you safe. And it's doing that because it doesn't realize that you probably are already safe. If the trauma has happened in the past and you're currently out of that traumatic experience, your body's still responding as if it's unsafe when you really are safe.
Thank you. Mhm.
Yeah.
Okay. So there are fears connected with this, but we have found that through EMDR, the fears are lessened very much after the first time people realize how much better they feel. And that definitely reduces any fears about additional memories that they'd like to work on. Yes. So EMDR stands for eye movement, desensitization, and reprocessing. We know so much more than we did 50 years ago about the brain. One of the reasons is the technology we have that does brain scans, and there's a lot of studies about this that have shown, where areas of the brain light up, etc. So EMDR has been greatly researched and is considered a highly effective method of helping people, and usually in less time than talk therapy would, and with less fear, because as Jessica said, people have the idea they're going to be talking endlessly about some trauma when that's not really the way it works. So I would say that personally, um, I first heard of EMDR decades ago at a workshop I was at, and I have to confess, I thought these people are crazy. When in reality, they were the forerunners of something that is now very highly researched and very accepted as an excellent method for helping with trauma. So, Cynthia, what does a session of EMDR look like? Could you tell us about that and why it's effective?
Yeah, sure. So with my clients, typically, if we're doing EMDR, we've already done the base work of taking a full history and building rapport, all of those good things. Probably have taught them some coping skills, and they feel safe enough to address the trauma, to work on it. So in a typical session, I'll do a quick check-in, maybe check on, any excuse me, any symptoms over the last week, any updates on their life and what's been going on with them. And then I try to ask uh, what they want to focus on during the session. Sometimes they just want to talk through something recent that happened, something that's been on their mind, but sometimes they'll say, no, yeah, I want to continue working on what we've been working on. So at that point, we'll activate one of the memories that they have chosen to work on. We'll use bilateral stimulation. Really, that just means helping your brain process the memory by focusing on left to right movements in the body. Um, Sometimes I do that with a website link. I send it to them. They're able to follow something on their screen, usually a ball, and they follow it left and right. Sometimes I have them do butterfly taps. They can also have headphones in and listen to sound move bilaterally left and right as they process this memory. We don't talk about the memory. I ask them to bring up the memory, what it looks like to them, what emotions are associated with it, but they don't have to talk through it and give me all of the details. They just tell me what the memory looks like, the emotions, the thoughts, how strong and disturbing the memory is. And then we do some of that bilateral stimulation. I'll check in with them, see how they're going. And then depending on what they say to me, how they're feeling towards this memory, I'll guide them to either continue or take a pause. Typically, after a few sets of the back and forth, they'll start to build some insight and start to have more positive adaptive beliefs about themselves and the situation that they went through. They're able to learn something from it, and able to maybe release the shame, the negative beliefs, any guilt or anything of that type. Um, at that point, we can install other positive beliefs about themselves. And if they haven't completed maybe processing that memory during the session, we kind of pause at a good spot, help them make sure that they're in a safe, calm, emotional state with the pre-taught coping skills, and then we schedule for another time. But it does happen often that we need lots of sessions to complete one memory. I would say that really the only times when it takes just 1 or 2 sessions to work on one memory, it's a very isolated event, like Dr. Barboza mentioned, just one big memory that they have, maybe just an isolated car accident. But if we're talking about repetitive memories or complex trauma, that's usually something that's going to take many sessions to work through these things, because there's so many um, memories that are stuck in their neural network in the brain that need to be taken apart and processed piece by piece. Again, like Dr. Barboza mentioned. As far as the effectiveness of EMDR, what we're learning, part of it is still kind of theory. We don't know 100% exactly how or why this works, but we're seeing that it works. And what it looks like is that during the bilateral stimulation, the left and right movement in EMDR, we are connecting both sides of our brain, the left side, the right side, right? So we are connecting the logical, what does this memory mean? What happened in the past? Why did this happen? Why did this person do this? Or, why was I in this situation? We're connecting that to the more emotional side of the brain, the how do I feel about this, and helping the brain process the memory, gain insight, and be able to come up with some sort of safety. Um, the brain will process the memory and take useful information from it. It's kind of like it's gaining from experience, and it's using it to teach itself what to do in the future should it happen. So it's kind of like that survival process. It's wanting to learn so that it doesn't happen again in the future, or so that it knows how to respond and how to react in the future should it happen. When the body is going through stress, the nervous system is unable to process and function sometimes. It depends on the person. It depends on how much support they have. It depends on maybe the environment and the people around them that help them or don't help them. So then that stressful memory or that stressful event, even if it is a test, failing that test, it's kind of just sitting there pending to be worked through until we can work through it either in talk therapy or in EMDR therapy. Because if learning has not occurred from that memory and that disturbance has not been discarded, then it's kind of just waiting there. And so in my experience using EMDR therapy with my clients, they are able to release some of that disturbance in their bodies, in their mind, their emotional state, be able to learn, gain insight from the experience, and then they're able to archive that memory in the past. That's how I've used it with my clients, and that's the effectiveness that I've seen with them.
Thank you, Cynthia. And you've probably heard of the amygdala, a part of the brain that's the fight or flight. And so when something traumatic happens, often it gets stuck in that part of the brain and doesn't get processed to the other side of the brain to where it's more of just a memory. EMDR doesn't take away the memory, but it greatly reduces the stress caused by the memory, and the brain processes it like they would other events. And so, Cynthia, you have a lot of good information there about all of that. And, originally it was thought that just following the therapist's hand would be the eye movement, but they've since learned that anything that stimulates both sides of the brain, be it arm or touch, so that's the bilateral tapping you can use, engages the other side of the brain where we want to move that memory to. And so it's just amazing. I like what Cynthia said about how clients feel so much different about the memory, and they even get insight that they didn't have before. And in my experience, I've seen them even be more forgiving than I expected at times, because they processed it and they don't feel as much animosity towards the event or the abuser or whatever. That's not necessarily one of the outcomes we're looking for, but it's an added one for some people. And one example of a client of mine is she saw me quite a while for talk therapy, but decided she did want to do some EMDR. And she had some traumatic memories from her childhood. But one that was really bothering her was Christmas Day, when she was about 10. She remembered being thrown down the basement stairs and her presents being thrown down on top of her. She couldn't remember who did it, but she suspected it was her dad, who had a lot of issues. So when we got to processing that memory, and when she was ready, because we prepare people first with what we call resources. And a resource is a safe, nurturing person in your head, who could be somebody real or somebody you make up. This particular client used a character in a book that she liked, was her safe, nurturing person. We also establish a safe, calm place that you can go to needed. And as Cynthia said, we contain the memory at the end of the session. We ask the client to come up with a container in their idea in their head. It's not necessarily real. And it could be anything that contains a memory. Clients are very creative about this when they create the container. And so what we do is, when they're ready, we take the memory out of that container. But at the end of the session, we put it back in the container. And usually the client has decided only they have control of that container. So that way it's not bothering them during the interim before the next session. So anyway, this particular client with falling or being pushed down the stairs was feeling very lonely, very sad, very angry, a lot of different emotions, which we processed during the EMDR. And she eventually came to see the event very differently, because she had forgotten that her brother came down to check on her. And she was thinking, nobody cares, no, nobody checked on me. But she remembered during the EMDR that her brother checked on her. They ended up opening the presents and having a good time. And to this day, she's pretty close to her brother. And she remembered now that that's one of the reasons that she felt like she could count on him. So anyway, that was one example. She has other memories that we're working on little by little. And sometimes, as Cynthia said, she wants to have talk therapy in between. So we do that depending on what's going on with her. Cynthia, did you have a client in mind you were going to tell us about?
Um, I, I mean, yeah, I have a few. Yeah, having to rescue a child from a building, unfortunately, the child having had already passed, and the memory that was stuck in his mind was the inability to bring her back to life through CPR. It was a memory that had been with him for years, that was pretty much haunting him daily, that had led him to abuse alcohol, and that was really impacting him in his relationship with his wife, and his ability to function at work. But after having had with him, it was only a handful of sessions, he was able to put to rest this memory. He was able to, again, gain insight, was able to recognize he did the best that he could. Really, there was nothing else that could have prevented her um, from dying from that was related to him. So he was, excuse me, able to gain that insight and reported greatly reduced anxiety, no longer seeing the image of that little girl in his mind, like seeing her face when he was trying to do CPR. He reported he was happier than ever, had no longer a desire for consuming alcohol, and felt true freedom. And he now felt that he was able to help others in a similar situation. He wanted to kind of mentor other firefighters that he knew that needed some help. And so, yeah, he was very, very happy with his hard work. He did all the work. I just kind of guided him.
Mhm.
And it was a great success story. Another one is just
There's so much information about EMDR. We may have to have another webinar because there's so much we can say, but we're kind of running short on time. And so I wanted to mention that I became interested in getting certified in EMDR because I had my own EMDR. I had had an event that was maybe a minor trauma, and so I didn't think that it, would need EMDR, but I couldn't stop thinking about it. And so I went and had EMDR and was amazed how it stopped me from obsessing about it. And even though I still had, some feelings about it, I felt amazed at how much better I felt overall. So, that is a personal testimony that EMDR was just great. Now, we are a spiritual group, so we do look at things a little differently at Rejoice and Laetare. And so one way that I know I am different than a secular therapist is I pray with and for my clients when they want me to. And I always ask the Holy Spirit to help me do the best work with them and for the Holy Spirit to guide their decisions and their choices. And so that's briefly why we're different than maybe secular organizations. So we are at the time here where we are going to switch to questions and answers. So we will take some